Hello dear viewers, this is me Zishan Ahmed. Welcome to our YouTube channel Medical Core. Dear viewers, in this short video we will focus on what is D-dimer blood test, why would I need a D-dimer test, what type of sample needed for it, and how you will interpret the results. So don't go anywhere, we will discuss it shortly. D-dimer is a protein formed when a blood clot breaks in the process known as fibrinolysis. As it formed from two D fragments of the fibrin protein, that's why it's called D-dimer. The D-dimer blood test is a screening test which measures the D-dimer protein in the circulation. Normally less than 0.50 mg per liter is circulated in our blood. Now why it is recommended by the doctors? So there are some reasons for which the doctors usually recommended it. These might be the deep vein thrombosis which usually is seen in the legs. Secondly, if there is pulmonary emboli, doctor suggested it. Besides these, if someone have the problem of disseminated intravascular coagulation or short T, DIC, the D-dimer is suggested. And if there is a snake bite, for that D-dimer test is also recommended. And lastly, to monitor the DIC treatment, doctors could D-dimer test suggested for the patient, which will reveal whether the treatment works or not. Now, what type of sample needed for the D-dimer test? So usually 3 to 5 ml of the whole blood is collected in the blue top tube or sodium citrate tube. After centrifugation, the serum is obtained and the D-dimer test is run on that serum. Now, if you get the results, how you will interpret it? So, as we know, less than 0.50 mg per liter is considered normal or negative D-dimer test. But if the value is greater than 0.50 mg per liter, then there could be two reasons of it. First, the blood clots which circulate in our body. And secondly, it might be due to the blood clotting problems which could be due to the thrombocytopenia or other reasons. But keep in mind that older people, pregnancy and recent surgery can falsely elevate the D-dimer value. You have to exclude these when you interpret the results. Thanks for watching. Do subscribe, like and share the